Hi everyone, how are you? Can somebody please let me know if you can hear me, okay? If you could go ahead and text in the message. I see Dr. D is on the line. Dr. D, if you could text me or comment if you can hear me and see me. Also, Cindy and Jerry Lynn, and we have more people joining in every second. Okay, you can hear me and see me. Excellent. So we're going to go ahead and get started. I hope everybody's having a great day. Thank you for joining me today while we talk about how to build with the International Health Professional Program. One of the things that we're going to do this afternoon is what I wanted to do with you is really let you know why we created the International Health Professional Program. And I wanted to talk to you about how it's alike and how it's different than the nutraMetrix program in the United States. Some of the things that I wanted to review with you today are just the tools that you have available to your disposal if you are building in the international market. So let's start off by talking about why the International Health Professional Program was created. And to do that, I'm going to go back in nutraMetrix history in the United States a little bit. You see, Market America was founded in 1992, and it wasn't until 2004 that we had a dedicated program called nutraMetrix for our health professionals in the United States. So, what happened between 1992 and 2004? Well, what was happening is health professionals from all around the country in the United States were being exposed to our great product line, like isotonics, like our Heart Health Omega 3. And they were being exposed to them by patients, by the natural way that our business is built through organic, person to person recommendation. So health professionals were being exposed to our product line, even though we didn't have a program specifically geared towards them. They started using the product line with their patients, and no surprise here, they started loving the results that they were getting with their patients. So health professionals, even though some of them didn't understand our business model, decided to partner with Market America. So over the course of that period of time, remember, we did not have a program specifically, formulated for health professionals. We didn't have a marketing approach for health professionals. We had no marketing materials geared towards health professionals. We just had the regular tools that unfranchised owners had access to. We developed about 400 health professionals that identified themselves when the company did a survey back in about 2003 to ask how many of our UFOs were health professionals. So we knew that we had this whole network of health professionals existing in our organization. And we went to them, Dennis Franks actually went to them and said, what can we do to create a program that will make the UFO model more attractive to health professionals? So they created a focus group with our pioneer health professionals. They looked at the sales that those health professionals were making, and they determined that we had enough health professionals on board already in our normal business model that they could warrant adding a separate brand, the nutraMetrix brand, a brand labeled exclusively for health professionals. So that was kind of the evolution of how nutraMetrix was created. We went from having the regular product line with the regular labels being exposed the regular way, person to person, that working through individual referral networks, health professionals came on board. They then identified themselves as health professionals, and then we were able to create a separate line for them. So fast forward till today, we've been getting lots of requests over the past several years to create the nutraMetrix model in all of our market countries: Taiwan, Australia, Hong Kong, Singapore, the UK, Spain, Mexico, Canada. Everybody wanted to have their own nutraMetrix brand in their market country, right? But what we need to do in order to get the nutraMetrix brand in that market country is follow the same process that the US did. See, we can't just launch a new brand there and not know if the market will support it. So, what we're looking to do is see, okay, we already have tons of UFOs in each of these market countries. Let's first start by asking them who in the country already that's an existing UFO has health professional credentials. And then let's identify them as health professionals and flag them in the system as health professionals, because right now we have doctors in each market that we don't know unless they tell us that they're doctors, that they're doctors. So we created the International Health Professional Program with a goal of doing it in two phases. We are currently in phase one of launching the International Health Professional Program. It launched in probably 2013, right? And so what we did with that first phase is we said, let's identify who the health professionals are in our existing market. And then let's train UFOs in that country to go out and introduce our products to those health professionals. And let's see how many health professionals we can get on board with the products that we already have available in that market and with the marketing materials that are all already available in that market. And one of the beautiful things about working from home is your pets always want to join you. I put the dogs outside today, but this time this one wants to climb on my computer. So anyway, let's kick her down and get started again. So what we've been doing is identifying who are the health professionals we already have, and then we want to create a relationship with them and find out what do they need from a marketing standpoint to make the model successful in their country, because each country has its own medical model. They have their own unique needs. They have their own unique desires for what would be successful in their practice, right? So we have already identified hundreds of health professionals in each market. We have over 400 health professionals that have already partnered with us in Taiwan. We have over 200 health professionals in Canada that have already partnered with us. We have health professionals in each market that are now flagged in the system as health professionals, and we are tracking their sales. So when sales get to the point that we can warrant having the separate brand there, then we will take the full nutraMetrix model there. Okay, so let's talk about how does phase one international health professional program that's live in every market country now compare to what we have in the United States? So let's talk about it from a product standpoint. In each market country, other than the US, we do not have the nutraMetrix brand of product. However, we have very comparable products available to that consumer market in those countries. So, what do I mean by that? I mean, in Taiwan, they're using the market Taiwan products that are already available and that have been available for years, even with their health professionals. In Canada, they're using the Canadian products that have already been available. In Australia, they're using the Market Australia products that are already available. There's not a separate brand there, but that does not mean that those products would not be attractive or useful in a health professional's practice. Keep in mind that even in the United States, where we do have the nutraMetrix brand, nutraMetrix has over 200 products on its price list. But not all of them are branded as nutraMetrix. Although they have nutraMetrix codes, the nutraMetrix Heart Health Omega 3 looks just like the other omega 3s. The nutraMetrix Aloe products look just like the other Aloe products. The nutraMetrix TLS products look just like the other TLS products. The nutraMetrix NutriClean products look just like the other products. So it's really only the isotonics and a handful of our capsules that have a specific nutraMetrix branding to them. The other ones just have a nutraMetrix code. So you don't need to have that separate label in order to be successful in working with health professionals, okay? So the products are the same products that are already available in that market. Now let's talk about who can work with health professionals in each market. In the United States, the only people that can actually open an account for a health professional are people that have been through the nutraMetrix consultant training. This is not the case in the international markets. In fact, in the international markets, just like when we were pioneering here in the US, anyone can open an account for a health professional. You do not need to be certified as a nutraMetrix consultant because we don't have nutraMetrix consultant certification in any market outside of the US. Once we get to phase two of the international program, where we actually launch the nutraMetrix full program in that market, then there will be a certification process required. But until that time, anybody can open an account for health professionals. So let's talk about this for a second. So I'm saying to you that people that aren't trained on working with health professionals can go out and work with health professionals in the international markets. That does not mean that those individuals shouldn't take the time to learn the resources that we have. And we have several resources available for you on downloads. We have several resources available for you here on MeetOn that work with the International Health Professional Program. So what tools are available? We have an International Health Professional Program guide and overview that is an FAQ document that explains what the program is, explains how it's different than the US, and it answers a lot of frequently asked questions about the program. We also have an international health professional guide. It's an implementation guide for UFOs working with health professionals. It takes you step by step through the process of how do you approach a health professional and how do you put an implementation plan in place. So those tools are available to you, as well as some of the marketing materials that we've taken from the nutraMetrix version and we've made them a little bit more generic for the international market. So for example, we have something called the Wellness Goals System with the Wellness Goals poster. That Wellness Goals poster basically says, on a scale of -5 to +5, how is the patient feeling today? It's a way for the health professional to dialogue with their patients and open up and have a conversation with them about why supplements might be necessary to help them feel better or meet their healthcare goals, right? So that poster, even though it was created for nutrametrix, it has been translated into every language for every market country that we have. So we have it in Mandarin in Taiwan. We have it in Cantonese in Hong Kong. We have it in Spanish, both in Spain, in Spanish for Spain, and we have it in Spanish for Mexico. So we have it in the appropriate language for each market country. Okay, so even though there's not a certification program for NCs or UFOs working with health professionals in the international markets, there are training materials that every UFO that wants to work with health professionals should make sure that they download and read through. We do also encourage, if possible, anyone that wants to work with health professionals in the other market countries to attend the nutrametrix consultant training in the United States. Even though the programs are slightly different, you will definitely benefit from learning what we teach about the nutrametrix implementation, because then you can adopt and swipe and adapt that material for your market country. We've trained hundreds of UFOs from Canada on implementation of nutrametrix. Even though we don't have nutrametrix brand in Canada, they're implementing nutrametrix style in the International Health Professional Program. We've also had attendees attend our US courses that have come all the way from Hong Kong, Australia, Taiwan, the UK. We have people from every market country that have attended our training. So if you're really serious about wanting to implement nutrametrix style in the international health professional market, there's nothing better that you can do to learn about the program than come to the United States and attend the US training. In fact, we have one for those of you in Mexico, for those of you that are building and you want to build now. Our next training with availability is in St. Petersburg, Florida, the weekend of April 15th. That it's going to go Friday, Saturday, and Sunday. So you want to make sure you visit either marketamericaevents.com or nutrametrix.com and click on the events tab to learn about that upcoming training, because you might want to attend there. So recapping so far, in the international markets, they use their existing market country products. Any UFO can work with a health professional. They do not need to attend the certification training in the United States, although it is helpful for them. There are several materials available for download, including an implementation guide, an overview document, an FAQ document, and something called, I didn't mention this yet, the conversion form. The conversion form is what we use to identify that UFOs in the international markets are actually health professionals. And the conversion form gets submitted with a copy of that health professional's license or certification and gets sent to the address at the bottom of the form. And our corporate team members will identify that person is a health professional. Then they'll go in the back office and give them health professional status. Okay, so existing market country products, no requirement to be sponsored by an NC, plenty of marketing materials and training materials available on downloads. In most countries, those downloads are available under the training tab on unfranchise.com downloads. However, if your market country does not have a training tab, then it would be under the sales aids tab, just in case you're wondering where they are. They're on unfranchise.com in the download section under either training or sales aids, and they'd all be titled something along the lines of International Health Professional Program, and then what it is, implementation guide, overview document, conversion form. But you're going to want to make sure that you go ahead and download those. And now let's talk about some of the other tools that are available that are similar to the US program in the international markets. One of them is the ability for, when we have identified a health professional that is interested in building through our international health professional program, there are really two ways that they can open an account. They can open an account as what we call an HP executive, and the HP executive owns a UFO distributorship just like everyone else that requires 2 business partners for activation. It requires qualification, and it follows all of the standard business building principles that are associated with the MPCP and outlined in the career manual. There is another option, however, for health professionals once they're identified in our system, is that they can come in as what's called an HP1. And an HP1 is really an introductory account for health professionals. It allows them to earn commissions without being activated, and they can earn the commissions on their own volume. So this is one of the biggest differences between nutrametrix in the US and the International Health Professional Program. So I want you to listen very closely to this. Now, this is outlined in the overview document, so you'll be able to refer back to the documents to learn more about that. In the international markets, when a health professional wants to build as an HP1, Let's say that they're very interested in developing a retail model in their practice. They want to be able to offer the products to their customers and their patients, but they're not really interested in building the network marketing side of what we do, right? They don't want to have to open any additional accounts. They don't want to have to sponsor anyone else. They don't want to have to do any recruiting. Then they can come into the system as the HP1 and they can sell products and earn retail profit just like everyone else. But what's different in the HP1 account is their business volume, their BV, will accrue from their own personal sales. They do not benefit from group sales from anybody that's placed below them, but from their own sales, they can earn commissions on their personal BV. So if they're retailing a lot of product, even without being activated and sponsoring two additional accounts, if they're an HP1 in the international market, they can earn commissions on their own volume that is created. Now, those of you that are building in the US, in the United States, group volume does accrue from below for HP1s. In the international markets, it does not. And this is because of the legalities in the other markets. It has to do with, are they involved in actually building? Remember, our MPCP stands for Management Performance Compensation Plan. And so if there's an HP1 that isn't building an organization and isn't managing an organization because of the rules in other countries, they're not managing anybody, so they really shouldn't be participating in the MPCP. This is why they can't earn off of group business volume, but they can earn off of their own volume in the international markets. Okay, so what you need to understand is the idea of the HP1 program in the international markets is it's really designed to be an introductory account. It's designed to help them build belief in the products because they're implementing them in their practice, they're getting results with their patients, and then eventually they're going to want to share those results with other people. And that's when you would convert them from that introductory HP1 account to a full HP executive account. And at that time, when they convert to a full executive account, they can benefit from the group volume that's being generated below them. So the kind of progression of what you want to do, you introduce a health professional to the products, you open the account for them as an HP1 account. You get belief built in the products. You get belief built in the system. They see that the program works. They see that the patients get results. Eventually, then you're going to move them into the HP Executive program where now they can earn full commissions, not just on their own volume, but also the volume of the group that grows underneath of them. Okay, and at that point, they would be an HP Executive. So those are really the big differences and the similarities between nutraMetrix in the US and nutraMetrix to be in the international markets. Right now, we don't have nutraMetrix in any market outside of the US. What we have is called the International Health Professional Program, which is phase one of getting the health professional program expanded into these other markets. Our goal is to be able to track the sales of the UFOs that are identified in our systems as HPs and HP1s. And we look at these numbers every month and we look to see what are they selling. And when the sales that they're producing warrant having the separate brand there, then we will launch the full nutraMetrix program in their market. That then and only then will they get the nutraMetrix brand. Would they get the nutraMetrix consultant type training? Would they get all the other tools that are available through nutraMetrix? But this is no different than how nutraMetrix evolved in the United States. It's the same exact way. It started with the Market America products, the regular Market America products, and then it grew to we had a core group of health professionals selling the Market America products. And then once we had enough health professionals moving enough product to warrant the separate brand, we created the separate brand and the separate marketing materials where needed. Okay, so Cindy writes, does this apply to EMP markets? Currently, the International Health Professional Program is only available in the existing market countries, not when they're an EMP market country. So not when they're an EMP, okay? But that doesn't mean that you can't work with health professionals in EMPs. They would just be regular UFOs. And then when that EMP, that emerging market program, actually becomes a market country, at that point, then the International Health Professional Program would roll out there and they could be flagged as a health professional simply by submitting a copy of the conversion form, okay? So how does this apply to all of you that are building internationally? Well, if you have health professional contacts in the international markets, you would approach them just like you would any other UFO. You would expose them to the market products just like any other UFO. But when they open their account, it's critical that you submit a copy of that conversion form with a copy of their license so that we know that they're a health professional. And that way we can begin to track their sales and include their sales in our goals for, okay, this is how much we're already producing, this is how close we are to launching the brand. Now we can soon launch the nutraMetrix brand in that market. Okay, so if you want to have nutraMetrix there, the full nutraMetrix program, the best thing you can do is go find health professionals, enroll them in the program, and then have their conversion form set in, have them produce sales by following the tools and the materials that are available. And once they've produced more sales, all that does is help bring us even closer to launching the full nutraMetrix program. Now, I do want to talk to you about some of the support that we have going on in a couple of our market countries right now. We do have a national field consultant, Michelle Yao, who speaks Mandarin, and she's been working very closely with our Chinese speaking communities to help grow the international health professional program in the Chinese and Asian markets by speaking Mandarin and doing courings and webinars and meet-ons on working with health professionals in Chinese. We also have a field consultant, Lexi Jalan Naraki, who does speak in Spanish, and she's been going down to Mexico and doing courings and webinars in Mexico for the market, the people working with health professionals in Mexico. And also, she has people from Spain that are joining in on some of her webinars as well. So, if you are Spanish speaking or Mandarin speaking and you would like more information about what's going on in terms of webinars and courings that are happening in Spanish or in Mexico, you can send an email to nutraMetrix@nutrametrix.com, and they will give you the directions on how to plug in to those Spanish and Chinese markets. But you can also watch Meet On here. If you do a search on Meet On, Lexi is going to be doing more of those international health professional program type introductions in Spanish, and Michelle will be doing more in Chinese. So you'll be able to find them here on Meet On as well. Okay, and with that, does anybody have any questions? Again, no need to be an NC in the international markets, but it does not hurt for you to attend the NC training so that you can learn how to build with people in any market. Make sure you download all the materials and go through them. As you go through them, if you have questions, you can post them in the official nutraMetrix NC support group if you are an NC, or you can email them to nutraMetrix@nutrametrix.com if you have questions and are not an existing NC. You want to make sure that you read those downloads, review them. There is contact information on where to get more information there. There are more videos. There's a series of 5 videos here on Meet On. So if you just do a search for International Health Professional Program, there's a series of 5 videos. One of them was done by Dennis and myself, giving an overview of the international program for health professionals. And the other 4 follow the tools that we have. And Lauren Sauerbeck, our former director of sales, created those, and they're still very relevant information. So you want to make sure that you watch those. It really walks through how to use the implementation guide, how to approach health professionals. So you want to make sure that you watch that series of 5 meet-ons that is available just by searching for International Health Professional Program on Meet-On. If there are no other questions, I know there's a little bit of delay, so I'll give you another minute to type in any questions. But if there are no other questions, then I thank you for joining me today. We look forward to seeing you and your health professionals at upcoming trainings, whether they are here or in the international market. And we will see you on future live meets. Thanks, guys. Have a great day.